Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. So this week's blog we're going to talk about arthritis. So in arthritis, what I'm going to do is I'm going to explain what it is, how it's treated, the different types of arthritis, and what we can do to help as a chiropractor. So first, let me explain what arthritis is. Arthritis is when joint spaces, whether it's in the spine or it's in the elbows, knees, feet, anywhere where there's motion involved, when that joint space gets dried out or lubricated. But first and foremost, what I want to explain is how you get arthritis. What I don't want you to realize is it's not an age-related disease. Yeah, a lot of people who are in their 70s, 80s and up have arthritis. But just because you're in your 20s or 30s doesn't mean you get it. I've seen patients who are in their 70s and 80s have a completely healthy spine. And I've seen patients who are in their 20s and 30s who have severe degeneration and severe arthritis. It's all on what they do with their body. So say someone had a severe car accident in their 20s. They might have severe arthritis by the time they're 30, 35. I've seen people who are 80, 90 do absolutely nothing wrong to their body, treated them right, go to the gym, have physical activity, eat right, and they have a completely healthy spine. So I don't want you to realize that it is not an age-related disease. It is a wear and tear disease. So explaining arthritis again, it's when the lubrication in the joint spaces are dried out and it becomes more of a bone-on-bone friction. A lot of patients that have arthritis complain of a lot of stiffness and pain. Now realize there are over 100 different causes of arthritis and different types of arthritis. The more common ones, rheumatoid's a very common one. That's a autoimmune disease. We see a lot of patients with rheumatoid. Obviously, they need to be managed by a rheumatologist. Gout is an arthritis. It is an inflammation things due to something called uric acid, too much uric acid in the body because you eat too much cheese or you have too much beer. Those are a lot of common things that cause gout. But the most common one that we see is osteoarthritis, and that's the more wear and tear situation. We see that every day in our practice. So here's what happens in arthritis. You got the healthy spine right here, and again, it happens in every joint in the body, the arms, the hands, the feet. I'm just going to use the spine as an example. So healthy spine, phase 1 degeneration, phase 2, phase 3. Yes, these are considered degenerative disc diseases, but again, arthritis is between joint spaces. So there's a joint space here, there's a joint space here. That's all causing the arthritis. So patients with arthritis have that stiffness type of a pain. However, when it gets severe and it puts pressure on those nerve roots, that can be a patient who has symptoms going down their arms, hands, fingers, and it may require decompression. So that's a little bit about arthritis. Now, how do you treat it? Again, arthritis is just like degenerative disc disease. What's there is there. It can't be reversed, but it can be stopped or managed from getting worse. Now, in a mild patient, chiropractic will just be fine. And a lot of patients go to an MD, they get anti-inflammatory shots. Again, those are just numbing the problem. They're not actually fixing the problem. Where our job as chiropractors is actually fixing the problem, enhancing the nervous system. But we also realize that there needs to be a little bit of supplementation as well. So in a mild case, a chiropractic patient, they just need adjusted. Someone who's more moderate to severe arthritis and is getting pain going down their arms, hands, fingers, if their exam calls for it, decompression is the way to go. Now, there's also a couple different things that we recommend for patients. First, physical activity. Worst thing for a patient to do is do absolutely nothing. Arthritis, a lot of stiffness. Moving will get those joints mobile and you're not going to be as stiff. So that's a big thing too. Eating right. With a diet, you're going to maintain a weight. Whenever there's more weight involved, there's going to be more stress on the joint spaces, okay? Another thing, we have a couple different supplements that we sell here in the office. Here are the first two. We have vitamin C and vitamin D, okay? Vitamin C helps with collagen, which helps with your joint spaces. Vitamin D works directly with the bone and keeps that bone nice and strong. Now, calcium and magnesium are also really good options for arthritis. Now, we don't have those in the office, but they are very good supplementation to help keep those bones nice and strong. And magnesium also helps with muscles. We do sell a supplement that does have magnesium in it, but it's more so for muscle spasms. And that's something we can talk about a little bit further down the road. Next one is Formula 419. Okay, so 419 is a inflammation supplement. This is given to patients who have severe inflammation. We give this to a lot of patients with gout. Gout, again, is an inflammation disease. Arthritis is an inflammation disease. So some patients, we may recommend this if it's that bad. And we give this to all our decompression patients. So in inflammation, the only thing we have to ask patients with this supplement is if they have any ulcers. And if they do, we cannot give this to them. Otherwise, there's absolutely nothing wrong with this supplement. Here's the last one. This one's called Baxil. I give this to a lot of patients who have pain in their knees, their feet, their elbows, smaller joints, but it can be used for the spine as well. Baxil contains something called hyaluronic acid. Hyaluronic acid is what's in each joint space, in our spine, in our knees, elbows, so on and so forth. Typically by the age of 35. This is where the age factor does come in a little bit. Typically by the age of 35, our body stops producing hyaluronic acid, which is when arthritis starts to kick in, stiffness, pain, the bones start to rub on each other. This contains that hyaluronic acid. Okay, so it's a great supplement. I've seen patients do really well with knee pain and elbow pain. What it does is it brings that back into the joint space and helps your joints to lubricate a lot better. It's also beneficial for your skin and hair. Now, no, it doesn't grow your hair back, because believe me, if it did, my hair would be long by now. This is a great supplement. If anyone has questions about this, this is probably our best supplement for arthritis pain. It does not have any taste. It does not have any smell. It is FDA approved. Again, if it wasn't FDA approved, we wouldn't be selling this. But it is FDA approved, and it works very, very well. So there's a lot of different things that you can do to help manage arthritic pain, and hence the word manage. Again, it's not curable because it's there and it's there to stay, but it can be managed from getting worse. And people live completely normal lives in our office based off of what we do with these supplements and what we do with their adjustments. So that's all I have for you guys this week on arthritis. If you have any questions, let me know. Give me a call, shoot me a message, and I'll be happy to answer any questions for you. Otherwise, it's a rainy week, but we're starting to get some warm weather. Start getting out there, getting your gardens ready, start moving around. If you have arthritis, that's going to be a great thing for you, especially that sun hitting on your skin. That's going to feel really good. So if you guys have any questions, feel free to give me a call. Have a great week.